Hi everyone, welcome back to the Medical Care Organizations course. Today we are doing Chapter 2. This is our second lecture of the course or second lesson. And today we are going to be looking at our cultural beliefs and values as Americans and as it pertains to healthcare, the healthcare system, and public health. And we're going to look at kind of the difference between public health and medical and kind of what differentiates them and why they're sort of different. One is, more government, and then the other one is private. Let's dive right in. Okay, so I hope that what I did record here a minute ago did not go away, but we're first, so basically our, let me see if I can, black, red. Okay, so our definition of health in the United States is based on the biomedical or the medical model of health. Okay, so that is basically, it's just, we focus on the physical symptoms. Okay, so if you have physical symptoms, then we target those physical symptoms. We focus on relieving those symptoms in some way. If you don't have any kind of physical symptoms, then you don't have any disease. So rather than focusing on on the cause of the symptoms, okay, we like to look at how can we relieve those symptoms. We don't necessarily try to dig in and try to fix the problem that caused those symptoms. So that's a biomedical model of health, and that is what we use in the United States. Okay, that is what we use here. Now, next we have the medical sociologist definition, which defines health as a state of optimum capacity of an individual to perform his or her task and expected roles in society. So this one adds it's not just focusing on the physical aspect of health, but it also adds in a social aspect. So if you can't do your expected roles in society, then you're not necessarily healthy. So this is pretty much trying to put in our minds that you're healthy when you are a productive member of society and you're fulfilling your roles. If you're not, then there's clearly something wrong with you. The Society for Academic Medicine defines health as a state of physical and mental well-being that facilitates the achievement of individual and societal goals. So this definition introduces a mental element, okay? So it's not just physical, it's not just, hey, what's hindering you from fulfilling your roles, what's going on with you, or we're not just focusing on physical symptoms like, hey, this person's clearly sick, so they feel ill and we have to relieve their symptoms. This definition says you're healthy if your physical state and your mental state is sound, okay? Next, we have the World Health Organization definition of health. So they define health as being a complete state of physical, mental, and social well-being, and not merely just the absence of disease or infirmity. So here they introduce a social element, okay, to health. So it's kind of like the previous one, but now they're also saying, hey, social well-being is also very important, not just physical and mental. Okay, and keep in mind that this is the world definition. They're thinking, the World Health Organization focuses on everybody. It's not just thinking about one particular country or one particular group of people. And because if you were, then you would just be focusing on their culture and their particular beliefs and values having to do with health. But the World Health Organization has to kind of be able to span and relate to everyone. Okay, this is for the world, all the people. Okay, so Next, we have the holistic definition of health. Okay, so this emphasizes well-being as every aspect of what makes a person whole and complete. This is going to incorporate not just the physical, mental, and social well-beings of health, but they're going to introduce a spiritual dimension as well. So there are 4 elements to health in the holistic medical definition. So next, we're going to look at how us in America, how our American values and beliefs have influenced health and how we perceive health, how we govern our health care, and how we've pretty much created our system of healthcare in the United States. So some of the main elements that have influenced our values and beliefs are the advancement of science, okay, champion of capitalism. We actually, in America, we love capitalism, okay? We also love entrepreneurship. Collectively, we have this distrust of the government. We don't like taxes. We don't want the government in our business. We don't want the government to kind of tell us what to do and what we can do. So we don't really like policies and things like that. And like, again, these are collective values, okay? Collective values that are just kind of floating out there. We're all kind of tapping into this to some degree. You may or may not agree with what I'm saying, what our cultural values and beliefs are personally, but these are like the values that are out there and that kind of the majority of us, of the people, buy into this to some degree, okay? So we're very into science. We believe in science. We believe in capitalism and entrepreneurship. We don't like the government. We don't like the government when they kind of get into our business, tell us what to do, and we're not really a fan of, I think a lot of us kind of buy into a lot of conspiracy theories and whatnot, so we have this distrust of the government. And we also have this concern for the underprivileged, and you'll see this a lot because that's why charities show up, okay? So anyway, as a result of these beliefs that we have, these collective ideas and beliefs and values in America, we've manifested this private system that is not financed by taxes, okay? Although we do have the government playing some financial role in our healthcare system through Medicare and Medicaid. So yes, the government does sort of finance it a little bit through taxes. However, it's not that much. For the most part, our healthcare system is very private. It's privatized. We have strong feelings about making changes in the financing of healthcare. Especially in the past, we've always kind of been somewhat against having some sort of like national health insurance system. Okay, so this whole Medicare for all thing, this idea has been floating around for 100 years. But, the forces against that idea have been stronger than the people who have been for it and the people who have been, trying to make something like this happen. So yes, in recent times, now we're kind of coming to the idea that, yeah, we need this, or a lot of people are. Well, we might be kind of split down the middle, but in the past, this is not a new idea, but in the past, the forces that have been against that idea have been very strong, okay? So it's been shot down many, many times before in the past. Also, we do not... When we define health, we look at someone who is sick or ill or has a disease when they show symptoms, okay? We don't really look at the cause or anything, so we don't really focus on things that could result in sickness or disease. We look at the disease and then we kind of like, let's relieve that. All right, so we don't look at what kind of presupposes the existence of disease. We're just not, we don't do that in America. We also like to use clinical diagnoses and medical interventions to treat disease, or modern medical interventions that stem from the biomedical definition, which we looked at on the previous slide. So you're at optimum health, or we consider you being at optimum health when you just don't have symptoms. Okay, if you don't have symptoms of something, you're healthy. We don't really consider other elements that could be ailing you. So next, let's look at the differences, the difference between illness and disease. Because I know even I do this, but we all kind of use the word illness and we use it like it's a scientific term. Okay, but realistically, illness, that's how you feel. You feel ill. Okay. That's your own perception. That's a person's perception of how they're feeling. Okay, so people are ill when they infer a diminished capacity to perform their tasks or roles that are expected of them by society. Okay, so it's a feeling. A disease is an actual diagnosis by a medical professional. Okay, so that's an actual doctor or practitioner telling you that, okay, yes, you are sick. This is what's wrong with you. There's an actual medical problem here. Illness is not necessarily, that's not an actual medical problem. Okay, so you can feel ill, but does it necessarily mean you have a disease? Probably not. Or you might, yeah, but a medical practitioner needs to say that you do, and then move forward from there. So illness can, that's really just your own perception. I can feel ill. I can think, someone's face makes me ill, but it doesn't mean it's causing a disease in me. No, not really. Okay. So next we're going to look at the 3 different types of diseases. So we have acute conditions, subacute conditions, and then chronic conditions. Okay, so let's start with acute. And these conditions are not cute at all. Okay, these conditions are relatively severe. They're normally episodic, which means they're not going to be there for very long. It's usually a relatively short period that you're going to have this condition. Okay, and that could mean because it's so severe that you don't make it, or they treat you and then your disease condition kind of moves down a notch, so you're suddenly in another different type of disease level. So acute conditions, typically they're treatable, okay, but they are the most severe, most complex. Typically acute conditions are going to be treated through tertiary care interventions. Okay, so that's most high, or the most complex level of care. Now, subacute conditions, that's kind of like the next level down, okay, knocking it down one level. All right, so this is less severe than acute, however, it's not as less severe as chronic, which we'll get into in a minute. So subacute is going to be a little bit longer lived than acute conditions. So if an acute condition might last a few days or something, a subacute condition could last a few months. Okay, so it's going to be relatively a little bit longer in duration than an acute condition. Okay, and this is going to be a little bit less severe. All right, and it's the level of care that it's going to require through treatment is probably going to be secondary to tertiary care. Okay, some primary, possibly, Anyway, let's move on to chronic conditions. So chronic conditions is the least severe of the three. All right. However, this is the longest kind of condition. It's so long, in fact, it could last throughout your whole lifetime. Okay. Sometimes patients never recover from a chronic condition, and it's just something that they have to maintain. Sometimes it could be, this chronic condition might last for a couple of years, months to years or so. But many times it's just something that you have to live with and maintain for the rest of your life. Chronic conditions are usually taken care of through primary care, primary care interventions. So some examples of how you can move through the different types of diseases could be, let's say you are in a car accident, so a pretty severe car accident, but you walk out, you're fine. You get to the hospital and you've broken so many bones in your body. So at that point, they have to rush you into surgery. They have to put your parts in place and whatnot. And so they're treating your acute condition because that's pretty severe. It's episodic. It's going to be short in duration because during that time that you have the acute condition, they're just, patching you up, putting your bones in place, however that works. I'm not a doctor. So anyway, and then you move down into the subacute condition section or level of disease because now you just have casts all over you. You have your plaster thing, and you're just going to kind of be sitting in that for several months until it heals, And then you move into the chronic condition phase because your casts come off and you start moving on with your life. You've already kind of done your physical therapy, which is usually done through the subacute condition phase. So now you're in the chronic condition stage because all those fractures that you had eventually caused you to have arthritis. So now you have arthritis, and that's just something you're going to have to live with, or maybe you have like a pinched nerve, or just something that you're just going to have to kind of maintain, deal with forever. So that's my example. If you have a better example, I would love to hear it. You can go ahead and put that into the comment section or shoot me an email. Anyway, so next we have the epidemiology triangle model, and I'm pretty sure almost all of you have already learned all about this model, so we're not going to get into it too deep into this, but we do kind of need to know the basics, basics of how this whole thing works. So first of all, the agent, that would be like the pathogen, or it could be the just like little fragments or just something that's making you sick. Could be a virus, like what we're dealing with right now. It could be anything else, but it's like that one thing that is making you ill, The host is usually us, but the host can also be, if we're looking at dogs, the host would be a dog. If you're any kind of other animal, just really depending on like what you're looking at, but the host is the host that contracts the agent, or that the agent is affecting in this situation. Now the environment is the environment can be, the environment is where the host is. The host moves around in the environment. The host might catch the agent through the environment. The environment may influence the host's progression of disease, or it might reduce progression of disease. So the environment has a huge effect on the host and also the agent, and how with how a disease might develop. Okay, so let's move a bit forward. So anyway, a host can only get a disease. You can only contract a disease if there is an agent present. Okay, if there's no agent present, no disease, right? So anyway, however, in order for the host to get sick, it does not always, whether a host or when a host has an agent, okay, it's contracted an agent, the agent is in the host, however, it doesn't necessarily mean that it's always going to get sick. It's not always going to contract the disease. People may be asymptomatic, okay? It might not do anything to the host, and it could be a result of the environment that the host is in. Maybe there's nothing that's going to trigger that host to react to that agent in the environment, okay? Or it could just be genetic factors or any kind of behavioral activities or anything like that that may not trigger the agent to make the host sick, right? Have you guys heard of the story of Typhoid Mary? I always bring up this example because it's kind of funny. So anyway, there was a long time ago, back in the old days, there was this woman named Mary. Okay, her name wasn't Typhoid and last name Mary. It was like her name was Mary. All right. And the thing is, she was a cook. She made food for rich people. Now, she actually traveled quite a bit, and she made food for people wherever she went, you know, where she was. So, and the thing is so what, you know, during her travels and during, you know, her job, her occupation while she was working, she would make food for people, and then I don't know, I'm assuming she doesn't wash her hands, or maybe she coughs in the food and just they didn't think about things like that back then. But she apparently would be passing on germs to typhoid germs to her, you know, to the people who are eating her food, and they would get sick, and many people would die because this was typhoid. Okay, so she moved along and was making food for people, you know, for years. And at some point, they were able to finally trace down all these typhoid deaths to Typhoid Mary. Okay, and the thing is, she never had symptoms. She never knew she was sick this whole time. But she did have the agent present inside her. She just never had the disease. Okay, so we can be asymptomatic, and we can pass on disease. Okay, so a host does, even though there's an agent present, you might not get the disease. However, a host, there must always be an agent present in the host for a disease to even happen. Okay, that's what I'm trying to say. Moving on. Okay, so there are 3 different types of preventions, or different levels of prevention. Okay, so first we're going to look at primary. Oh, also do not get the different levels of prevention mixed up with care. They're completely different. They're different. All right, just don't get them mixed up. All right, please do not. People do that all the time. Okay, let's not get prevention mixed up with care. So anyway, primary prevention these are activities that you do to decrease or restrain that a problem or a disease will occur. Okay, so this is you taking action to make sure you don't even get the disease. Like right now, we have the coronavirus going around. Okay, so this social distancing thing that we're practicing right now, and we're staying home and we're not going out, this part of this, these are preventative measures for us that we are practicing so that we don't catch this airborne disease. Okay, so we don't catch this pathogen that's in the air right now. So this is a primary prevention intervention that we're doing. Okay, so we are taking measures to prevent a disease from even happening. Boom. Okay, next we have secondary prevention. Okay, so secondary prevention, this is early detection or treatment of disease. So if going back to the coronavirus situation, secondary prevention would be when people start coughing or they think that they feel sick and then they go into urgent care. I don't have it. So you go into urgent care and then you tell them your symptoms and ask for a test kit. I know that right now, I think we're running very, very low on testing. I heard there's one person who, this was a couple weeks ago, she thought she had the virus and she went into urgent care. They didn't have a way for her to test. They were completely out of testing supplies. So they were just like, well, you don't seem very sick. Go home and let's see what happens. Okay, if you get worse, come back and we'll treat you. So she went back home and then, you know, she didn't really get worse. It kind of just played out. And then she's just like, I don't know. She goes back to urgent care to test if she had it a couple days later. And then they're like, you know what? It looks like you may have had it or maybe you didn't, but either way, you're fine. It never worked its way through. You're done with it. You're good. But anyway, secondary prevention. This would be, this is taking tests, taking diagnostic tests to see if you have something. And if you do, this is the early treatment of that disease. So if that person were to have been able to check if they had the coronavirus, and if they did, then they would have taken, you know, early treatment protocols. I don't even know what they are, but that would have happened. So in order to, you know, block progression or just to try to stop it and not, you know, allow the disease to progress and move forward and all that. Also, this whole social distancing thing and staying away from people, this can also be considered secondary prevention as well, because if you have the disease, you are actually, and you're able to not be hospitalized, like you can actually be at home. They tell you to take care of yourself at home. Do not go around other people so that you spread the disease. So you want to block the progression of this disease, you know, of moving the disease to other people and infecting other people by just staying at home and taking care of yourself. Okay, so then we have tertiary prevention. So this is rehabilitation, this is monitoring. This is where you prevent further injury of your disease or your condition. Okay, so basically at the tertiary level of prevention, you already have the disease, you already have your health problems, it's already taken effect, you're already probably receiving treatment, but the thing is we do want to take measures to make sure that things don't even progress, things don't get worse. So you want to prevent any kind of further injury, any infections, you know, for you to lose any of your daily functioning or anything like that. So an example of this would be like if you are a bedbound patient, what they do many times, like if you're bedridden, you're hospitalized, they'll kind of like turn you, okay? They'll turn your body this way for a while, and then a couple hours later they'll turn you this way for a while, okay? And that's just to kind of like prevent bruising in those areas, because if you bruise or blister, sorry, if you blister, that means, you know, your skin is broken, okay? So your skin breaks, and you get risk of being infected by other things. Okay, so you could easily get infections on your body just that way. So in order to prevent that from even happening, we want to move you around and make sure you're getting like a good amount of, putting a good amount of weight on all your different sides, and it's not just sitting on one spot, wearing out the skin and the muscle tissue and all that, rubbing and stuff like that. Anyway, so public health. Public health deals with the populations. Okay, it does not deal with one-on-one time with a physician and a patient. This is populations. So kind of think about what's going on now. We are taking, with the social distancing thing, we're taking preventative measures to minimize risk factors of spreading this disease. So we want to contain it wherever it is, and we don't want it to spread anywhere else. So that's why we are doing this whole social distancing thing. That's why there was a public health order for us to stay home and to not spread the virus. Okay, so right now we're kind of dealing with a public health issue. So sort of like, I hope that kind of gives you a better idea of, or just a better understanding of how public health kind of works. Okay, public health, they focus on populations. They care about the health of the population and put out, interventions and measures to improve the status of the populations. They're not really interested in that one-on-one time. That's the privatized medical version of health. Okay. So really public health is trying to look at the population and going, let's try to prevent disease. Let's reduce, all these risk factors. Let's try to prolong our life. Let's raise our longevity, our life expectancies. Let's promote health. Let's try to, reduce heart attacks and, just try to make the health of the population improve. Okay. So public health versus medicine. Medicine, like I keep saying, it's privatized. It focuses on the individual. Okay, it focuses on the patient. We focus on biological cause of disease and treatment, while we focus on physical symptoms of the individual. Okay, not the population, the individual. All right, we treat disease of the individual. Okay, public health, on the other hand, public health focuses on populations. Okay, we like to identify environment, social behavior, and whatnot, and figure out what's going on with that and create like population-based interventions to sort of improve the problems that are happening there. Okay. Public health tries to prevent disease and promote health through influence. Okay, not necessarily just one-on-one time with the patient. Influence, of populations, of larger groups of people. Okay, so public health is mainly run by the government, whereas, like I said, medicine is privatized. Okay. Okay, so how in the world? Well, how in the world? Okay, so the thing is about healthcare in America, or healthcare anywhere really, is every country or, everywhere. The resources, or healthcare resources, are finite. Okay, they're limited. We only have so many. It's not like air, like we can just, it's fine. We can just breathe as much air as we want and it's not going to affect anything. It's not like I'm taking, not by me breathing, I'm taking air from other people. Okay, there's plenty of air to go around. Okay, however, healthcare resources are completely different. Healthcare resources are finite. They're limited. Okay, so, and we have so many people and we have this growing population. So how do we allocate the resources in such a way that it's equitable? Okay, it's equal, it's fair opportunity for everyone. okay? There are two different theories that deal with this, that kind of shed enlightenment on how resources should be allocated throughout society. So the first one, or both of these theories, sorry, would be market justice and social justice. All right, market justice and social justice. Let's look at those. So what is social justice and market justice? Social justice is when we treat healthcare, or social justice having to do with healthcare would be is if we treated healthcare like it's a social good, okay? Like it's something that everyone has equitable access to, no matter what, okay? Like air, okay? We all have the right to have air, right? To breathe air, things like that. And the equitable distribution of, so in social justice, the equitable distribution of healthcare would be a social responsibility, okay? Everyone would have to help everyone. And in order to do that, it would be a system where we would probably all contribute to healthcare through our taxes, and then probably the government would distribute the whole our healthcare resources accordingly, okay, depending on like what we need as a society. All right, so social justice, if we were to implement social justice completely, it would be through the planned ration of resources, and the planned ration of resources would be is this term called supply side rationing. Okay, so supply side rationing, an example of that would be kind of like how Canada, what they do, because they also implement supply side rationing. Basically, any country that has like a national or socialized healthcare program, they're going to implement supply side rationing because they're only going to have so many resources, and they're going to have to allocate that equitably throughout the country. So what Canada does, like for instance with their like MRI machines or other equipment that they use for healthcare, they don't just allow any hospital or any business to just have an MRI machine, okay? Not every single practice is gonna just purchase an MRI machine, let's say, because like how it is in the United States, where we can just open up business, we can get MRI machines going, we can have other imaging machines happening in our business and just start charging and start scanning people and all that, right? In Canada, since the government is going to pay for it, it has to be a planned thing, okay? It has to fit within the budget, and typically they're not going to buy extra equipment like that unless they need new equipment for their facilities, or maybe their population grows, okay? So what they do is they will have like one MRI machine per a certain amount of population, okay, like in every area. All right, so let's say, I don't know, for example, maybe it's like 1,000 people, there's like one MRI machine. I don't know if that's the actual number, but just for an example, just a certain amount of population, they get one facility or one MRI machine, or however that works. Okay, so that would be supply side rationing. You have your supplies and you're going to kind of ration them and distribute that according to need. Okay, and so market justice can really only happen if we have a complete free economy. Okay, that's the only way this actually lives. Okay, where you can have a full like market justice system. Okay, so if we were to use a market justice system, healthcare would be treated as an economic good. Healthcare would be an economic good. All right, so just like any other economic good that we have out there, like a yacht, or, not everyone can afford a yacht, and it's not the government's responsibility to give everyone a yacht. It's if you can afford a yacht and you wish to have a yacht, you can go get yourself a yacht. A better example of this would be, well, actually, let's move on. So in a free economy, if we were going to implement market justice, healthcare would be an economic good, meaning you have to pay for it. It's completely your responsibility. You are going to work hard, you're going to earn the money, and you're going to pay for your own healthcare. Now, keep in mind, this is a free economy, because this can only work in a free economy, not the quasi market like what we have in our society right now. This has to be completely free market, okay? Because it has to be governed by like laws of supply and demand. Competition has to be like pure, okay? So in this type of a situation, it would be regulated, or healthcare as an economic good would be regulated through demand-side rationing, or another term for that would be price rationing. Okay, so what is that? Demand-side rationing or price rationing would be let's say as healthcare kind of moves forward, and all the hospitals and the practitioners and every facility or everyone who sells their healthcare services or their treatments, they would be competing against each other. So they would have to lessen their prices in order to get business from the consumers. Okay, so they're going to be there's going to be competition amongst the providers, and it's because they want the patients to choose them, to spend their money on the healthcare that they're going to provide you. So demand-side rationing and price rationing is how the prices are going to kind of ration, or they're going to reduce as a result of this competition that is going to happen amongst all the healthcare providers. Okay, so kind of like how like transportation. Okay, we all know transportation is pretty much our responsibility, right? Okay, it's not really the government's responsibility to provide us with transportation. However, we all know that transportation is very important in society. We have to get places. We have to go to work. We have to go to places for fun. We have to go to places where we see our family. We have to, do we have business to handle? We gotta, we have to move. We can't just sit in one place in our like little cave forever, right? So transportation is very important. However, transportation is completely our own individual responsibility, right? There are different modes of transportation. We can get first class in a plane. We can have limos. We can have very expensive luxury cars, or there's buses. There's bikes. We have junkers. You can buy an old, used, crappy car. Whatever. It's completely your responsibility, but there are different amounts of money that you can spend on your transportation. We have Uber, we have other things like that. There are buses, taxis, everything. We have a lot of options, right? So you have options, there's a lot of competition, and it's your responsibility, giving your money and what you're working for and what is important to you, to choose which mode of transportation that suits you best. Okay, and that's how it would be in a market justice system if you were to implement that and then use that as a way to allocate the resources for our nation's healthcare. Okay, so it would just be like, it's completely your responsibility. You would have to learn about whatever you have and like the different treatment options that are available. You have to shop around for your own prices. There's going to be luxury versions. There's going to be, the crappy junker versions. There's probably going to be the public versions. Okay, so there are going to be different levels of the different care that you are willing to get, and it's all going to be your responsibility. Okay. So in a social justice system, like I said, this healthcare is it's a collective good, right? It's going to be the responsibility of society, which really kind of just means it's the government's responsibility, because the government represents society. We elect the government to kind of govern society, but it's us who do that, right? So it would be completely controlled by the government, and the government would have to figure out a way to allocate all the resources equitably, given how much we have, whatever our budget is, okay? And there are certain situations where social justice may be a great idea, okay? Think of situations, or consider situations that have to do with like disease epidemics, kind of like what we're going through right now, okay? See if, or, well, maybe in a more extreme case, all right, imagine like a zombie apocalypse, okay? And let's say that there's the cure for this, you know, if you get bitten by a zombie, there's an easy cure, it's like an injection, but you have to, you know, go to a health facility. If you catch it and you're slowly becoming a zombie, you have to go get your cure, your injection from the hospital, okay? And okay, so in a social justice system, most likely that cure is just going to be readily available for everyone, because it's very important that we do not let this disease progress. We don't want everyone to become zombies, right? We need to preserve our society and the health of our society, right? But if it were a market justice system, and it's completely everyone's own individual responsibility to get that injection, you know, that cure to, you know, get rid of that zombie virus, not everyone is going to be able to afford that, okay? Right? Not everyone is going to be able to walk in, pay their however much money it costs to get that injection and get rid of your virus, right? So in this instance, all right, you know, in a market justice system, we would have rich people or wealthy people, people who maybe have a savings, probably the middle class, you know, all that would probably be okay. Okay, they would probably be able to get their injections and cured and all that. What happens to people who really cannot afford to take care of themselves, to take care of their health? What happens to those people? They keep the virus, they stay zombies, right? And they go on to infect everyone else, okay? So they keep spreading that through our population. The health of our population is not going to increase unless we help everybody, okay, in situations like that. Okay, so in that instance, a social justice, it may be important to consider the social justice situation, you know, in a public health sense, right? I kind of already went over this, so let's just move on. You can go ahead and go through these slides at your own leisure, because we sort of already went through this. Next. Okay, so Healthy People 2020. It's 2020. Okay, so are we aware of basically every decade, the Public Health Administration they usually release like a 10-year health plan, okay, for the nation. And how this happens is they take surveys, they keep track of the health of the nation, okay, and throughout this, they do more of like a very comprehensive survey. They figure out exactly what's wrong with us, what are our health issues, if there have been any kind of improvements in the last decade, they would include that in this initiative, right? And then they will put out new health objectives for the next decade to come. Okay, so every decade there's a whole new set of health objectives that we set out there, and we're trying to achieve that. And so what the public health of this nation is doing is they're going to create, throughout this decade, they're going to create interventions to try to hit all the different populations and get them on board to improving their health through this action plan. Okay. Now we're going to look at how, in public health, how do we even evaluate the health of a population? Okay, so there are a couple different things that they like to do to figure out exactly how healthy a population is or how not healthy a population is. So some of the things we can do is we can measure morbidity. Okay, so that's like the level or the rate of disease or disability that is permeating a population. Okay, and then we have mortality, which is the death rate. So I'm pretty sure you guys already understand what that means. And anyway, so how do we measure morbidity? First of all, let's look at a couple different terms. So we want to look at the at-risk population, the population that is at risk of contracting any kind of disease. So this would be all the people in that same community or group who is able to acquire a disease or a condition. So whatever disease you're talking about in any given situation that you're looking at, whatever disease you're trying to focus on, and you look at that particular community that you're looking at, and then you try to figure out who actually is at risk of acquiring this disease. Is it really everyone in that population, or could it be just the elderly? Could it be the infants? Could it just be like male or female? You know, is it a sex-linked trait or a disease or something? Okay, so it's something to consider when you're looking at morbidity. Next, we're going to look at incidence. So when you're looking at incidence, that is the number of new cases that show up and amongst all of the people who are at risk. Okay, so if you're looking at a particular disease and you want to focus on a certain community, you establish who is actually at risk for this particular disease, and then you look at all the new cases that are showing up with that disease in that population of at-risk people. So you're going to figure that out just by dividing the number of new cases by the amount of people that are at risk in that community. Okay, then let's look at prevalence. That's another important one we need to know. And that would be the measure of the total number of cases at a specific point in time. Okay, and then you're going to divide that by the specified population. Okay, so the specific community, area, whoever you're looking at, whatever your focus is. Okay, so prevalence is you want to find out how, like the level, or how hard did it really hit that community. So you look at that specific point in time and all the cases, not the new cases that are happening, all the cases that have happened in that specific point of time divided by that population that you're focusing on. Okay, so let's look at some death rates. Actually, you can look at these yourself. There are basically all different ways that we can look at the death rate. So crude death rate would just be the total deaths divided by the total population. But that's not the only cool thing you could do with death rates. You can look at age-specific death rates, cause-specific death rates. So like cause-specific as in like if you want to focus on a particular disease, like how many people died of, dare I say, coronavirus. So if you want to look at the death rate of coronavirus, you look at how many deaths there were from the coronavirus and then divide that by the total population. Okay, and then you can look at infant mortality, different ways we can look at the death rate. And next we can look at longevity, which is a little bit more exciting. So we can look at your total life expectancy, which would just be the prediction of how long a person's going to live or how many years that they have left. Then you can look at life expectancy at birth, and you can look at life expectancy at age 65, which is how many years that person has left after the age of 65. Okay. Then we're going to look at the last two things we're going to go over right now is how they sort of in public health, well actually in long-term care, how they evaluate whether a person is in need of long-term care services and what types of long-term care services do they need. Okay, so the activities of daily living, this determines whether or not a person really has to live, needs assistance with their daily living. Okay, so this is kind of determine whether someone needs like a caretaker or to live in an assisted living center or something. This kind of a test would sort of determine whether or not this person can really be by themselves and live completely independent. Okay, so some of these activities would be that we check would be whether or not they can feed themselves, whether or not they can bathe themselves, dress themselves, use the toilet, transferring, which is like moving from one position to another, like if you're moving from like your bed to your wheelchair or something. So if you can transfer yourself from your bed to your wheelchair, okay, you're independent. But if you cannot do that, you're going to need assistance. Okay, can you groom yourself? Can you walk at least 8 feet, or at least move, like transport yourself at 8 feet without help? Next are the instrumental activities of daily living, or I like to think of it as the independent activities of daily living, because this really basically determines whether or not you can be completely independent. Okay, no assistance whatsoever, like you're fine. All right, so can you use the phone? Can you drive a car, or can you use some form of transportation on your own? Can you go shopping? Can you prepare your own meals? Can you feed yourself? Can you do any kind of heavy housework? Can you wipe your table? Can you sweep your floor? Can you make your bed? That type of housework. Can you take your medications, or are you just going to start putting things in your mouth? Can you handle money? Can you walk up and down stairs? And can you walk half of a mile without assistance? Okay. And that is the end of chapter 2, or lesson 2. So if you have any questions, go ahead and you can put a question in the comments below or on the website, or shoot me an email.